Joining me now is Green Senator Sarah Hanson-Young and Liberal Senator Sarah Henderson. Welcome to both of you, Sarahs. Let's
Hi, Sharri.
it's going to get very confusing over this next panel. Look, let's start with making the topic of Victoria today making compulsory, mandatory mask wearing. Sarah Henderson, if they're so essential in combating the virus, why haven't we been told to wear them from the start? Why did the Prime Minister and Greg Hunt change their tune on this?
Well, good evening, Sharri. And the Prime Minister and the Health Minister have not changed their tune. Of course, we are reluctantly accepting the recommendation of the Victorian government that this is now necessary. Excuse me, I got a bit of something in my throat. And the reason it's necessary, Sharri, is because we have had a catastrophic failure with hotel quarantine, which is the primary source of the community transition, the spread of the virus in the community, unlike all other states and territories who've done really well. And, of course, let's not forget that we were effectively at zero at the beginning of June. And then we've also had a very massive issue with the Victorian Department not able to do the necessary contact tracing. Some 1,000 active cases, and there wasn't the contact tracing within the required period of time. So we've now seen a very serious situation unravel in Victoria, and we have reluctantly accepted that advice.
Sarah Hanson-Young, even if the federal government and the states had pursued an elimination strategy, we still would have ended up in this scenario, wouldn't we? Because it was a failure of the security at hotel quarantine.
Well, of course, what we've seen is just a devastating kind of retreat from where we all thought we'd gotten. I think perhaps, you know, there was a bit of a sense that we're a bit ahead of ourselves, that this virus is just so vicious and so infectious that it really, you can't be complacent. And I guess that's why I think we need a stronger response in terms of, and a bit of a rethink of the strategy, because this suppression strategy thus far hasn't beaten it. We're now in the midst of a second wave, and the Greens are calling for a bit more of a discussion and a real think about proper elimination. But of course, Sharri, that would require a big effort, and for everybody to be on the same page. And when it comes to this issue of mask wearing, and I think this is a really important health advice that's been given today, the compulsory wearing of masks if you're outside. The challenge is going to be making sure everybody has access to one, that those who are found not to have one, I think some of those fines, you know, $200 fines, for some people, they're just not going to be able to afford that. So I think there's going to have to be some elements of how do we encourage people. And we've all got to be on the same page about this. The last thing we want to see is the mask wearing become a political football, you know, kind of a symbol of ideological debate, such as what's happened in the US. Like, that's crazy. Let's just follow the health advice and get on with it. But one of the other things I think is really, really important, if we're serious about eliminating this virus, getting back to some type of normal, we've got to help people when they are sick to be able to stay at home. We need effective sick leave for people, whether you're casual, whether you're kind of on a week by week allowance and you've run out of sick leave. The Prime Minister's announcing on Thursday, of course, this week, his kind of next steps of financial support. I really urge the Prime Minister to heed that very serious advice that he's been giving, and everybody has, the medical experts, that if you are sick, you need to stay at home. In order to do that, we've got to provide people the ability and the means. Some people can't afford it. They can't afford to take 2 weeks off work because they won't be able to pay their rent. They won't be able to put food on the table. Let's make sure we have proper paid sick leave for everybody who needs to be in quarantine.